Hello students. So continuing with the average length of stay, we have discussed till now why average length of stay is so important and how it judges the quality of care given by the hospital. Now let's talk about the hospital scenario or the practical hospital scenario. What happens is that when a patient is admitted in a hospital, the patient is either critically ill or needs to be stabilized or go on for a long-term treatment or maybe admitted for a planned treatment. So ultimately the goal of the hospital is to stabilize the patient and to give the necessary treatment. So in the whole process, the hospital tries to minimize the stay of the patient and minimize the length of the stay of the patient. With that, stabilize the patient and complete the treatment of the patient. So admissions, why do we say that? Why minimize the length of stay? Because when hospitalization occur in a healthcare setting, there is not just the disease that the patient is suffering from or the ailment that the patient is suffering from, but the patient is in a very much immunity compromised state. So he is also very much vulnerable to get the various infection from the healthcare setup as well. So that is also called the nosocomial infections, or we also name it as a hospital acquired infections. So since there are a lot of iatrogenic complications that the patient may suffer from, if the patient stays in the hospital for a longer period of time, then the patient gets unnecessary exposure to various infections. Now, if the patient gets exposed to various infections, nosocomial infections of the hospital, then again that will increase the cost of the patient party as well as the hospital, as the patient will have to spend more money in getting the antibiotics and will have to stay another couple of days to get that infection again treated. So which will ultimately harm not only the patient but also the quality of the care given by the hospital. So the length of the stay has to be minimum, and it has to be in such a way that the diagnosis is done correctly, the treatment of the patient is done, you know the patient is being stabilized, the patient doesn't get any nosocomial infection, and then you send the patient home. So the length of the stay in hospital, as we said, is the outcome of a complex system of hospital specific and location specific factors. So the ability to discharge a patient is a key factor in overall length of stay, and discharge destination is commonly recognized as a major determinant of length of stay. So ultimately, it's all about that the patient first, in the first hand, when the patient come to a hospital, first you try to treat the patient as an outpatient and doesn't make the patient admitted to the hospital. But if the patient has to get admitted to the hospital, the hospital have to make sure that the patient stay for the minimum days. Now that is again another part of the story, that if the patient stays for minimum days also, then it might happen that the patient party, or the patient might himself feel that the doctor, the hospital or the doctor have sent the patient in a haste just because they wanted to minimize the treatment. So minimize the days, the time or the day spent by the patient in the hospital. So it is very important that the patient stays in the hospital for the appropriate point of time, of course minimizing the length of stay, but also not compromising on the length of stay, and also giving them the proper treatment but not prolonging the treatment so as to prevent any nosocomial infection or hospital acquired infection in the patients. So I hope you have got what an average length of stay is. I hope I'm understandable to you, that you have been cleared with the concept of average length of stay and why it is so important for hospitals to take this measurement very seriously. So thank you so much.